morning, viewers. I thought I'd take this opportunity to talk about EFT, Emotional Freedom Technique. It's a very, very good technique. It's one of the most amazing techniques that I've come across, that I've used in my treatment sessions with my patients that suffer from emotional traumatic events. So if any of my patients suffer from anxiety, panic attacks, phobias, or they have fears of whatever nature, or depression, anxiety, stress, any of those symptoms, we can use the tapping technique to overcome these problems. Now, and regardless of what has caused the problem. So I've written them both in the two books that I've got available for you guys. The one is The Tired of Being Tired to the Point of Being Hurtful. This is a chronic pain book. It's basically how I got over my fibromyalgia, my chronic fatigue, and all my depression, things that I've suffered through. I've written it all in this book, all the different techniques that I've used to overcome it. And this becomes your self-guide to improve your own health. So do yourself a favor, get a copy. I've had very good reviews about this book, verbally, if not on the internet, but very, very nice book. It's down to earth. It's an easy read book. A lot of my patients say to me that when they read the book, they can hear me talking in like as if they were getting a one-on-one session. So do yourself a favor, get the book. The EFT technique is described in the book. In the How Not to Stress Out book, it's also described in here because it talks about the different types of stress that one gets, and then what one does for each of those different types of stress, and the tapping technique is explained in there. But very, very effective. I call it the tapping technique. A lot of the people will ask me, are you doing anything different? But it's just a straightforward tapping technique. It doesn't matter which hand you tap on the side of the hand and on different points of the body or on different points of the fingers. And what you will constantly say is, even though the bad thing, I'm okay and I'd like to accept myself anyway. The important part about it is to be able to rate your feeling out of 0 to 10, where 0 is no problems in that area and 10 out of 10 is severe problems. So for instance, if we had to take anxiety and you had to rate your anxiety levels, 0 would be no anxiety and 10 out of 10 would be extreme anxiety. And some people that get panic attacks tell me, no, it's from a 20 out of 10. So the important part about the tapping, I've had many patients that have been for psychology or been to see a psychiatrist or psychologist, and there you get taught to just ramble your story off. And a lot of the patients, when they come in here, they just start rambling and telling their story and that, but there's no thought linked to it, there's no emotion linked to it. They just feel that they need to tell my story, and this is not how the technique works. If you are just going to ramble your story off, we're not going to get to the nitty-gritty of how you felt about it, what it caused you, what emotions were experienced, what teachings were taken out of that situation. So when you do the tapping, it's prudent to perhaps have a list of problems list of events that you've gone through. I explain it in this book as well. We talk about a timeline, and in the timeline you want to go from birth to where you are currently, and you want to have any negative event. So be it a car accident, be it a traumatic hijacking, be it knowledge that your parents are getting divorced, or that somebody's being diagnosed with cancer, or a death in the family, or anything like that. So you would basically put the event, give it a title, so death of family member. You'd write your age or the year, and you would write the emotion or symptoms that started up from that. So maybe you started with depression, or maybe you started with headaches, or maybe you started with abdominal pain or diarrhea, any of those things. And if it was a symptom that started, so say for instance there wasn't really an event that occurred, but a symptom started when you were in grade 2, I want you then to think about what you had perhaps been doing over that period of time. Had anything happened to you? Maybe you went on a camp, or maybe you went and helped do outreach work, or maybe you did something with your parents, or maybe you went and swam in a smelly dam, or it might not always be negative effects, but something might have happened, and then after that event you started with the symptoms. Now this is very important, because if we know what caused the problem, so in other words we can go back to the time when it started, and I'm very particular with my history when I take it from my patients, because it doesn't help you just come and tell me your symptoms. That means nothing to me. I need to know what was the causative effect of those symptoms, so what caused them. And that you need to go back to identify, when did it first start. So I might ask you, did you have this problem in primary school? And then people go, no. I said, did you have this problem in high school? Not in the beginning, but maybe in grade 10 it started. And then I said, okay, well, what happened in grade 10? Oh no, my parents got divorced, or I failed the test, or I got pregnant, or there's a range of different things that could have happened to you. And once you've identified the cause and the result or the effect, then one can go back. Is it an emotional problem? Is it a physical problem? Is it a mental problem? And then we use the tapping technique to overcome this problem. Now, by the time you start getting panic attacks and have huge symptoms of anxiety, you've often experienced a number of events. So you might have had, and they're not necessarily big events. It could be small events all along the line, but you've got 4 pages of small events. I'll also talk about in the How Not to Cope, How Not to Stress Out book, about I mentioned earlier the different things that causes stress and anxiety, or what causes stress. And one of them is I write down the list of things that cause depression. So if we have a look, see here somewhere, you've got a list of depression items, or maybe it's not in this book, but all the things that cause depression. And then from that, it will give you an idea of have I got the ability to get stress, or did it happen, or what do I need to do? And from there, I can't find it in the book right now, but what are the top 10 stresses that you can get? It's loss of a loved one, divorce, changing of financial situation, be it getting more money or less money. So all of these things have an influence on the body, and that can influence your children too. So that's when their depression can start for no apparent reason, or they felt unloved, they felt unwanted, they felt not cared for, they felt unsafe. Any of these words can be used, and then you want to rate it out of 10. And then the higher the rating, we then use the tapping technique to, even though the bad thing, the event that happened, I'm okay and I'd like to accept myself anyway. And the important thing is, when you go back to that memory, apart from identifying the feeling, is to take out a good message out of there. You've got to take out something positive. So if you're going through a divorce and you've got children, the positive thing would be the children that you had. If you hadn't married that person, you'd never have the children. But there's such a huge range of different things that one can experience that is positive. But that's where sometimes a therapist comes in handy, where they can look through your problems and then identify what the positive stories are out of that, just from listening to how you're speaking. So it's very effective, and sometimes it's so effective that in one session you can eradicate depression that you've had for 40 years. If you can find the event that caused that depression, and you work on it and eradicate the emotion from a 10 out of 10 down to a 0. So if you're guilty and you've got a 10 out of 10 guilt and you get it down to a 0, that effect is gone. And if I ask you, because the brain can't tell the difference between reality and fantasy, when we work using the tapping, I often get you to imagine the event changing and doing something different. So maybe you'll sit the people down and have a discussion with them, or maybe you'll envision an angel coming to your rescue, or maybe the angel will take you on a trip somewhere and your body is left behind to experience what it's going through. So either or, whatever you decide, you can go on a beach or wherever you want to vision that you've gone. The brain will remember the new memory. And I've tested this out on a number of patients, and I'll say to them afterwards, and the next session I'll say to them, remember we did this, go back to that memory and tell me what you see. And then they'll tell me, oh no, they see the white light, or they see the angel, or they see the whatever we've put into that vision. And that feeling is still then a 0. I also talk about a forests. So you get a forest of depression, a forest of anxiety, a forest of fear. And what that means is you've got several events that will have caused the anxiety, or several events that would have added to your panic forest, or your anxiety forest, or your depression forest. So we might go down and work on 1 or 2 events. Remember, if you've got pages and pages of things that have happened to you, then it will take us time to get through those pages. I had a lady that I treated for 4 months she had 4 pages of events that had happened to her, A4 pages. And we took us 4 months to go through each of those events and tap the emotion that was experienced during that event totally down to a 0. And after 4 months, she was totally anxiety-free and panic attack-free. So it takes time, but it's not years and years and years of counseling. It's a short period of time of counseling. And you've got to be willing to share your emotions. I don't need you necessarily to tell me the event. If it's too shameful or too horrible to even think about or to express it out loud, then I need you to tell me what the emotion is so that I can work on it and give me more or less of a guideline as to what it could have been, so that I can guide the words in the correct direction, because it's all about the words that you hear. And once you understand and cotton onto the technique, it's the most powerful technique that you can have. And it can literally, if you felt guilty about something that you may have not done, it's gone. If you were even raped or molested and stuff like that, we can get those emotions down to 0. So it is very, very powerful, because if you don't get the emotions down, they become a physical attachment of your body, and they can create physical pain. So they'll create headache, they'll create back pain, they can create insomnia, they can create all kinds of manners of pains and problems, which then makes your life worse. So for 2 minutes of experiencing a really awful situation, or maybe it was a bit longer, but in the scheme of things, a half an hour or even an hour is nothing compared to the rest of your life. So use the tapping technique, EFT, Emotional Freedom Technique, to overcome all these problems that you've experienced. And remember, if you are struggling to do it on your own, get yourself a qualified therapist that can do it in this. And often they've also done the matrix re-imprinting. That's where I spoke about putting a new picture in the memory. And the matrix re-imprinting is the brain then hooks onto the new memory, and it doesn't remember the old memory. And if you've only got good memories upon good memories for each of the negative events that you've been through, then you can only have a positive outcome, and your body will show this. I've had many patients that have done the tapping technique, and they go to work, and people look at them and they say to them, what have you done differently? Have you got makeup on? Have you cut your hair? Have you colored your hair? Have you changed your clothing? You look really good, because it starts to shine outwards. So it's very, very effective. And sometimes it's such a sneaky technique that you think, oh, surely it can't be that simple. You know, can this technique be so easy? Can it be so effective? And can it be so simple? And I am astounded every single time when a patient tells me, who's been suffering with depression or anxiety for many, many years, and they get up and they tell me it's gone. And then I think to myself, how is that possible? Now, I know the technique is really good, but I am floored every time it works, because it is just such an amazing technique. So don't underestimate the power of it, and go and try it out. Give your therapist a call if she can do it for you, and get over your problems. It's not impossible to do, and you've just got to be willing to do the work and do the tapping, and it's a technique you can do easily at home yourself. So that's there for you to take. It's there for you to use. Get your copies of the book. They are available on Amazon. They're also available from me directly. And learn how to overcome your own fears and problems. If you don't have the finances to go and see a therapist, this will help you as well. If you too nervous to talk to anyone, this can help you as well. I am writing these books, and I'm doing these things for you guys so that you can get better, because I know not everybody can get here, and not everybody can get to a therapist, and not everybody trusts people. So use my books. That's what I've written them for. I've written them for you so that you can get better. Have a wonderful day. If you know friends and family members that are suffering from stress, anxiety, depression, panic attacks, send them this link. Let them watch the video. Let them get their copies. I will give it to them as a present for their birthdays. It's an amazing present. Many people have said it's wonderful. So please, and rate this video. If you felt that this video was useful and you've learned a lot out of it, then please go look me up on Rate Your Physio, Leslie Mayer. And there's one on Google, and there's one on the site Rate My Physio. And give me a rating. Let me know how you find these videos. If there's more videos that you'd like me to make on different avenues of pain or headaches or back pain, there are a lot of videos that I am making. I think up new ones every day. And I have my patients that give me information and tell me which ones they want to do. So I do them willingly for them, and I do them willingly for you. So let me know what you'd like, and let's get this country feeling better. Let's get everybody happier so that we can overcome all our traumas and feel happy and enjoy what we do on a daily basis, because I do. So thank you for watching. Tune in again to the next video. Have a wonderful day. Bye-bye.